Joining us now, member of the Senate Foreign Relations and Judiciary Committees, Democratic Senator Chris Coons of Delaware. Always great to have you back on Morning Joe. He is, by the way, backing Joe Biden for president. Just want to put that there. And start with the president's news conference and announcements last night about the coronavirus. Do you believe that he is handling the issue correctly?
Well, Mika, I was pleased to see President Trump come to the briefing room and to actually give a press conference, something that's become quite unusual, and to name the vice president to lead the administration's efforts. But I regret having to say this, but we all know that President Trump, in the course of his service, has disrespected science and scientists, has told an awful lot of untruths. And his own record back during the Ebola virus outbreak, which happened when President Obama was president and Joe Biden was vice president, President Trump stood on the sidelines and helped with the fear-mongering and the spread of disinformation. So I hope that the administration and President Trump in particular will respect the scientific leaders, the very capable leaders at NIH and CDC. His budget proposed deep cuts to these vital organizations. He left empty or dismissed folks who were put in place in the previous administration at the National Security Council to handle pandemics. And in some part, Mika, this is chickens coming home to roost. It may sound like a short-term savings to empty out an office that isn't actively being used to fight pandemics. But when something comes up like this, it'll show that we're not well prepared. And I'll remind you, there is still an Ebola outbreak in Africa, in the Democratic Republic of the Congo. In Congress, we are going to have to work well and quickly across the aisle to provide financial support for a robust response. Well,
this is something we were talking about yesterday in terms of this White House and some of the incompetence that some say has been revealed over the years, but incompetence literally can be a killer in this case.
In this case, it can. So, Senator, with the president saying that he'd even accept Chuck Schumer's $8.5 billion budget for this, would that fund things to a degree where some of those spaces could be filled?
Yes. We ultimately appropriated roughly $5 billion in response to Ebola, an outbreak that was largely contained to 3 West African countries, but where preparedness and research and response here in the United States cost quite a bit. This is an epidemic now, a pandemic that has hit, I think it's at 47 countries now. And last night, the CDC was reporting what may be the first case of transmission in the United States that's unrelated to someone who's returned from China. So I think we all have to work closely together, and the level of resources needed may rise quite quickly here.
You know, and the thing, Dr. Dave just sent me a New York Times breaking article about how in Japan, they're now shuttering all schools. To try to keep it under control. We don't. Again, Americans, I think, need to understand how quickly this can move and how greatly it could impact everybody's lives.
No question about it. And the CDC, I think yesterday, officials there, Senator, tried to make that point as they came up and spoke after President Trump, saying, we don't know where this is headed. There's a lot of uncertainty around this. We should expect more cases. But you have a pretty good perspective on these things. As you pointed out, you took a leadership role in 2014 during the Ebola crisis. How should Americans be looking right now, as of this morning, at the coronavirus? And a lot of people have pointed to the fact that the CDC says as many as 61,000 people could die in this country this season just of the flu. 3,000 people have died around the world of the coronavirus. But we did get that report yesterday of a new case in Northern California of someone who reportedly had not traveled to one of these countries or traveled outside the country. So how should Americans getting their kids ready for school right now be looking at the coronavirus?
Well, 3 things. First, it's important to make a really clear distinction between Ebola, which is very deadly but does not transmit between people easily, and coronavirus, which is very easily transmissible between people, we think, from what we know so far, but is nowhere near as deadly. It's closer to the seasonal flu than it is to Ebola. But if it is transmissible by people who don't have symptoms, then it's going to be much, much harder to track and contain. And so far that is suspected but not fully proven. So it'll travel much like the flu does in the annual flu and cold season. and folks who are particularly compromised, who are either very young or very old, or who are immunocompromised, cancer patients, for example, are really going to be at risk. And so we're going to have to take the public health precautions that, frankly, we should be taking during the seasonal flu season, about washing our hands and avoiding contact and isolating people who are sick. But this is going to strain our nation's public health resources to the limit, and it's going to require measured, capable leadership that respects the science. And we're going to have to resist any temptation on the part of folks in office, whether the administration or Congress, to play politics with this. The public needs to have confidence. I have great confidence in the folks at NIH and CDC. We need to listen to them and the public health officials in every state and community and follow their directions.
All right, Senator Chris Coons, thanks so much for coming on. We'll talk to you again soon. Thank you.